class, in this video we are going to talk about the peripheral nervous system, and then we will start in on the central nervous system. Depending on how long it is, I'll be longer, but then have this be the last video for chapter 3. We just have to talk about peripheral nervous system, central nervous system, and then ways to look at the brain. So the peripheral nervous system, we're talking about that first because it's shorter. There's not much to go over. The peripheral nervous system is all of the neurons outside of the brain and spinal cord. Everything except brain and spinal cord falls into the peripheral nervous system, all of the neurons outside of that. For the peripheral nervous system, you have a few divisions, and so I'm going to show you how this works. So you have your peripheral, hold on, let me fix this. One moment. So you have your peripheral nervous system. And then that is divided into autonomic and your somatic peripheral nervous systems. The somatic peripheral nervous system is all of your voluntary, your conscious activities. So when you say, I'm going to scratch my shoulder, that is your somatic peripheral nervous system that is doing that. It is neurons sending a signal from your shoulder to your brain saying this itches, and then the neurons outside of your brain and spinal cord that say scratch, move your arm to scratch it, all of those motor neurons in your arm that are scratching, that is all somatic because you are choosing to do it. It is a voluntary thing. The autonomic peripheral nervous system is all of the internal organs, its glands, everything that's not considered voluntary. So the motor neurons that tell your heart to pump, the motor neurons that tell your diaphragm to contract, those are all autonomic. You can't control it. You can't make them stop just by thinking about it. So autonomic peripheral nervous system is the automatic stuff. The autonomic peripheral nervous system is further divided into the sympathetic and then the parasympathetic. The sympathetic autonomic peripheral nervous system is your fight or flight response. So that is what, sorry, my dog wants in. That is what goes when you when you get afraid. That is going to be everything that, it's the neurons that tell your blood vessels to open wider so more blood can pump through your heart, more oxygen can get to your brain, all that fun stuff. The parasympathetic autonomic peripheral nervous system is what I call the rest and relax part. It's the day-to-day functions. It's your guts. It's digestion. It is, it's everything that is sort of right in the center. It's every day-to-day thing that doesn't activate during fight or flight. So sympathetic, fight or flight, parasympathetic, rest and relax. The way I sort of distinguish them, sympathetic comes before parasympathetic because it's shorter, it's within it, and you have to freak out before you can calm down. So that's how I keep it straight in my head, but however you keep it straight, you do you. In your peripheral nervous system, you have two types of neurons. You have sensory neurons and motor neurons. And I'm going to get rid of this so I can describe these. For your sensory and motor neurons, there's technically a third type of neuron as well. Overall, there are 3 different types of neurons in your in the peripheral nervous system. You only have sensory and motor neurons. The interneurons, the third type, are only found in the central nervous system. But I'm going to talk about all 3 now so you can understand how they work. So let me draw a person here. Let me go with blue. So you have, say you want to touch a flame, because I don't know, you decide to. We draw a little stick figure here. So you have a flame. I don't want that to be blue. I want that to be red. So you touch a candle flame. And so you're going to touch it, you're going to feel heat, and then you're going to jerk away. You're going to move your hand away from it. This is going to involve both the central nervous system, because your spinal cord is going to send that reflex to move, as well as your peripheral nervous system, because it's the voluntary muscles in your hand that make you move away. And it's the sensory neurons in the peripheral nervous system that sense the heat. When this happens, you are going to use all three types of neurons. You're using both the peripheral and the central nervous system, all three types of neurons. The signal from your hand, that's a little wonky, that should be an S. The signal from your hand to your spinal cord saying pain is your sensory neurons. Sensory neurons send information from your extremities, from your senses, to your spinal cord or brain. So sensory neurons send the message to the spinal cord. And then it's the motor neurons that send the message to your hand telling you to move. So sensory neurons send it to the spinal cord. Motor neurons send the message from the spinal cord to your hand saying move away from the flame. So that is the sensory motor peripheral nervous system. Within that spinal cord, you have interneurons. You will never have a sensory neuron talk directly to the motor neuron. Within the brain and spinal cord, you have a lot of interneurons, and those go in between the sensory neurons and the motor neurons. It's always going to go then sensory neurons to interneuron to motor neuron. This is often called the reflex arc, because it's always going to be this order. You are never going to have motor neuron, sensory neuron, interneuron, or interneuron, motor neuron, sensory neuron. It's always this pattern. Sensory neurons talk to interneurons talk to motor neurons. And so within that peripheral nervous system, you have sensory and motor neurons. Within that central nervous system, which we're going to talk about next, that's where you're going to find the interneurons. So those are the neurons that are in the nervous system. And again, no matter what type they are, they might appear different, but they all have those same components, that dendrite, the soma, the axon with the myelin sheath, the terminal buttons that has the synaptic vesicle at the end, and the dendrites that have the receptor sites. All the same components, even if they look different. So that is the peripheral nervous system. Next, we'll start in on the central nervous system. The central nervous system is the brain and the spinal cord. And I'll talk briefly about the spinal cord, and then we'll for basically the rest of this video. For your spinal cord, it's like a relay station in your body. So it routes information to and from the brain and the rest of the body. It also has its own automatic system. That's the processes that are part of that automatic system. Those are your reflexes. Because there are certain things that happen where you don't want to take the time to think about it, to actually have it go all the way to your brain and become part of your conscious awareness. Like when you touch a flame, you don't want to have to waste precious seconds deciding. You want your body to kind of automatically respond. So there are certain things that your spinal cord can do without your brain being a part of it, like reflexes. Oftentimes those are connected to survival type things. So that's the spinal cord. Again, most of this video will be focusing on the brain. The brain is bilateral, which means it has two sides. There's two sides to the brain, two hemispheres, we call them. So you have a left hemisphere and you have a right hemisphere. And the left hemisphere, the left side of your brain, is responsible for the right side of your body. The right hemisphere is responsible for the left side of your body. And so all the information that goes into your left eye goes to the right side of your brain. Everything in your right eye goes to the left side of the brain. That's the way it works. For your brain, you have your cerebral cortex. That's that surface of the brain. That has the gyri and the sulci. Those are the gyri are the bumps. The sulci are the grooves. If you've seen a picture of the brain, the bumps and the grooves in your brain, and that's all in your cerebral cortex, that surface of your brain. You have some lateralization. Lateralization is when your brain has specialized. Certain areas of your brain are specialized, do certain things. Be talking about in the brain is about this lateralization, what the different parts of your brain do. So, for example, the amygdala that we'll talk about later. The amygdala is responsible for your fear, the feeling, strong emotions, especially fear. And so if your amygdala is damaged, it's difficult for you to have fear because the part of your brain that's specialized in dealing with that emotion doesn't work anymore. So lateralization is specialization. There is a negative correlation between lateralization and plasticity. So plasticity is the ability of your brain to adapt its form and function. So it's your ability to change, for your brain to change. For example, so again, there's a negative correlation there. When you have lots of plasticity and not as much lateralization. As you get older, again, negative correlation, your plasticity goes down, which means lateralization goes up. As you get older, you have more specialization in your brain, but it means that it can't change as easily. So if you have damage to your brain, it is better to have that damage younger rather than older because your brain has a better chance of repairing itself or fixing itself. And so I'll talk about Jody to talk about this. So there's a girl, I'm about to show you a video of her, but I'll describe it and then I'll show you the video. Jody was a girl who had a disorder that it kills you. It's a degenerative disease, which means it shows up about the age of 4, and if you don't do anything about it, it will kill you within usually 6-7 years. And so the treatment for this disorder is sort of extreme. They take out half of your brain. So they take out your right hemisphere. And so a couple of things you'll notice for her. One is that she had half of her brain removed, her right hemisphere removed. So question for you. If her right hemisphere is removed, what side of her body should be paralyzed? And so that should be her the left side of her body. Remember, her right brain's in charge of her left side. So when her right brain is removed, her right hemisphere is removed, her left side should be paralyzed. But because she was so young, she was only 4 when this happened, she had enough plasticity. Her left hemisphere took over. Her left hemisphere started being in charge of movement for both sides of her body, not just the right side. So that's that sign of lateralization. If you have this disorder, you have to treat it quickly. You can't wait a few years to decide if you want to take out half the brain, partly because then it's more likely to kill you, but also because as you get older, you have less plasticity. If at your age now, since you are officially adults, if half of your brain was removed, if your right hemisphere was removed, your left hemisphere would not take over. You don't have enough plasticity at your age that you could lose half of your brain and be okay. But Jody was young enough that she was able to do this. So now what I'm going to do is show you that video of Jody, and then I will talk about something else after that.
We are beginning to harness the brain's incredible ability to invent itself, then reinvent itself throughout life. This girl is a testament to the amazing resilience of the human brain. Young Jody Miller leads an idyllic life as a 9-year-old girl. You would never guess that she has undergone some of the most drastic surgery imaginable.
Happy birthday.
Jody's first 3 years were textbook normal.
Happy birthday, dear Jody.
Then, about 6 weeks after her 3rd birthday, a storm of epileptic seizures took control of her brain.
She couldn't use her left arm hardly at all. She could barely use the left leg, seizing a good deal of the time, multiple types of seizures.
Ordinary life became impossible. Medicines did nothing, and the seizures threatened to turn fatal. Desperate, Jody's parents brought her to pediatric neurologist Eileen Vining.
We found her seizures were all coming from her right hemisphere. And we knew that there is virtually nothing else, nothing but Rasmussen syndrome that can produce that picture in a young child.
Rasmussen syndrome is a degenerative brain disorder that disrupts the electrical activity that makes our brains work. Tiny electrical explosions were flaring up in Jody's right hemisphere. As seizures became almost constant, she lost control of her left side. Only one radical treatment option remained.
We knew that she was never going to have her seizures controlled with medicine, and we knew that she and her family faced taking out that half of the brain.
Okay.
Dr. Vining recommended a daring surgery called a hemispherectomy. It would be performed by pediatric neurosurgeon Ben Carson.
The whole concept of taking out half of a person's brain would seem to most people impossible. Human beings are incredible creatures with a brain that is beyond belief in terms of its capabilities, to the point where we can take half of it out and still function in a normal way.
85% of our brain consists of the cerebral cortex, which is divided into 2 hemispheres, each with 4 main lobes. The cortex handles many of our higher functions. Areas on both sides control thinking, movement, and sensation. But the right side controls our left side and vice versa. Jody would lose almost all of her right hemisphere, and the cavity would fill with cerebrospinal fluid. The operation has to be performed with great precision to avoid damaging the parts of the brain that control Jody's life functions, like heartbeat and breathing. The surgery went flawlessly.
What we're looking at here is an image, an MRI, that was done on Jody after her surgery. And what it shows us is the fact that we removed her entire right hemisphere. And what we're able to see here is indeed her very normal left hemisphere and all the beautiful gyri of her cortex. And we can see right down the middle, the right hemisphere that was there is now replaced by fluid.
But how could Jody function normally with only one hemisphere? It's because of a miraculous ability of the brain called plasticity. Our brains can actually change shape, creating new connections between neurons or brain cells to replace lost or damaged ones. Jody's left brain started reconnecting almost immediately.
At least as good as this. And if I remember, he wore pink just like you. This young lady had half her brain removed, went home, I guess maybe 10 days later, and was already walking. She was ambulating. She was able to walk out of the hospital. And that's because her left hemisphere had such resilience, such plasticity. It was able to say, okay, something needs to move her left leg. Whoa. You gonna open it? Okay.
Jody continues to work on training her brain to overcome the slight paralysis in her left side.
But enough, now that's very good. You need to do that stretching stuff, honey. You know that, don't you? Are you doing enough of it? You think so? Atomic sentence.
The human brain is just an awesome thing because every time I look at it, I say to myself, this is the thing that makes this person unique. It still is just such a wonderful thing to find a young person whose life now can move on, who's no longer having seizures, who's developing in a normal fashion. I take the good with the bad, and I say, this is a bad thing, potentially, that we have to do for an extremely good cause.
Okay, so that's an extreme example. Again, that's called a hemispherectomy, just remove half the brain. Now, when they were talking about her disorder, her epilepsy, the seizures, the misfiring of electrical activity, that within neuron communication, that electrical activity, that's what messed up. That was all starting in her right hemisphere. The problem was that it transferred from her right hemisphere to her left hemisphere through the corpus callosum. And so the corpus callosum is this bundle of nerve fibers that connects the two hemispheres. It's why you can't draw a circle with one hand at the exact same time that you draw a square with the other. It's going to be a weird circle-square combination because half your brain is saying circle, half your brain saying square, and they're always talking to each other. So the problem with them always talking is that when a seizure starts in one hemisphere, it transfers through that corpus callosum to the other hemisphere. So removing the hemisphere that was starting the seizures led to them not transferring anymore because that half of the brain was gone. There is another procedure that is not really used anymore. Medicine has gotten better for epilepsy, but people with severe epilepsy previously who, a seizure would start in one hemisphere and then pass through and cause a grand mal seizure, can be devastating. If medication didn't work, again, before medication improved, they used to do something called a split brain procedure. And the split brain procedure is when they sever your corpus callosum. They destroy your corpus callosum. So your two hemispheres can't talk. You still have all your brain, but they can't talk to each other anymore. And so what I'm going to do now is I'm going to show you a video of a guy who had the split brain procedure, who had his corpus callosum severed. And Gazzaniga, the psychologist that you see talking in this video, he actually won the Nobel Prize for doing the research on split brain patients because it helped us really see that the brain was specialized and really helped us understand what the left brain does and what the right brain does, and the differences between them. So watch this video and then we'll talk about it a little more.
We began our journey into the human brain here on the campus of Dartmouth College in New Hampshire. I'd come to meet one of the world's leading brain scientists, Mike Gazzaniga, and a man he's worked with for over a decade. A man with two brains. You've been working a long time with Dr. Gazzaniga?
14 or 15 years.
Just it doesn't seem like that long, does it?
Well,
The collaboration began when Joe had surgery. And you had this procedure to correct an epileptic problem,
Yes.
is that right?
Trying to stop the seizures. I was having seizures like every day or so, or sometimes 2 or 3 a day.
To control Joe's epileptic seizures, a surgeon severed the connection between the two halves of his brain. Cutting the corpus callosum like this prevented the spread of the electric storms that caused his seizures. But it also prevented the left and right halves of his brain from communicating with each other. In the years since the operation, Joe's epilepsy has been under control. He now earns a living at an egg farm, and in his everyday life, he's largely unaffected by the fact that his left and his right brains work independently. Do you feel any different when you think about something than you did, any differently from the way you felt before the procedure?
It's just got a backup brain, that's all.
That's something everybody could use, right? I found out how true that was right away when I was asked to draw a different shape with each hand. In a brain like mine, roughly speaking normal, at least all in one piece, the left half of my brain controls the right side of my body, while the right brain controls the left side.
Oh, no.
But because the two halves are connected,
Nothing wrong with that.
getting each hand to work independently isn't easy.
well, we're seeing the fact that Alan's hemispheres are connected, and that the motor messages from one are confusing the motor messages in the other.
I was just drawing an upside-down duck.
Okay.
But when Joe is given the same task, his two hands operate as if controlled by two separate brains. What's happening is that each half of Joe's brain is given a separate instruction. He's asked to fix his eyes on the cross in the center of the screen. Anything flashed to the right of the cross goes only to his left hemisphere. Things to the left go to his right hemisphere. Because the two don't communicate, each hand does only what its half of the brain sees.
Wow, look at that. It's really like two different people doing the same.
That's right.
Same task.
That's the idea.
Okay, Joe, I want you to keep your hands out in front
In
of
an
you.
experiment that's now a classic in brain research, Mike Gazzaniga over 30 years ago used a similar setup to find out if the two halves of the brain are specialized to do different things.
Ship.
Joe is being flashed a word only to one half of his brain. Words flashed to the right
Storm.
are seen only by his left brain, and Joe can report seeing those words just fine.
Piano.
Good.
But when a word is flashed to his right brain,
Didn't see that.
Okay. Joe, I'm going to ask you
but now watch what happens.
to draw that with your left hand.
They got me lost.
Why don't you try drawing another picture of it over here if that will help you.
Oh, phone.
Oh, okay.
Sure.
It's almost as though somebody has given him a secret communication.
That's
and
right.
now he knows that it's a telephone. But up until then, he was blind to it.
Exactly.
When Gazzaniga first did this experiment, it instantly proved that the ability to speak resides almost exclusively in the left hemisphere. Not until he sees what his right brain is drawing is Joe able to name it. He said church, didn't he?
After looking at the picture.
Yeah, but he had to figure it out about as long as we did. That's really interesting. It's a picture here of somebody communicating almost with another person.
And the communication is not occurring inside the head, it's occurring out on the piece of paper.
Yeah.
Blob. I really don't know.
You want to draw a little bit more?
So far, Joe has been seeing only one word.
Cat. That's a cat
Things get
sound.
even stranger when he's flashed two words, each to only one half of his brain.
The right hemisphere saw toad.
Yeah.
And so his left hand draws a toad.
So there's the toad.
Oh, it's a toad.
And this time I was able to guess what was coming.
Will they put a little three-legged stool in there later, or what?
Joe's speaking left brain saw a stool. Saying the word lets the hand that's controlled by his right brain in on the secret.
That's great. That's really interesting. And if he had seen that with the corpus callosum intact, he would have drawn a toadstool.
Right.
Not a toad and a stool.
Right, exactly the point. I've been doing this for 35 years. Yeah.
And
It gets me every time.
Yeah, it must.
Okay, so you notice with Joe, he is able to do different things based on what eye stuff goes to, because that determines what side of the brain it goes to. So question for you, what side of the brain is considered smart? Okay, so again, it's the left side. Gazzaniga, through his research, found that the left side is basically the smart one. The left hemisphere is smart. The right hemisphere, not so much. So the left hemisphere is in charge of things like selective attention, a lot of your memory, emotions. The right hemisphere does some emotion. The right hemisphere is in charge of pitch perception when it comes to music. It also has to do with some visual things, art, that sort of stuff is more on the right, but anything connected with language, anything really sophisticated is going to be in that left hemisphere. And that is the split brain procedure. And actually, I'm going to stop this video here so it's not like 45 minutes long. And in the third video, we'll talk about just specifically some parts of the brain you need to know and how to look at the brain.